Okay, that sounds like something that you need to see me about. Would you be able to come in and see me this morning at 10:30 face to face?
Dr. Ian Kennedy takes a patient call at his practice in Inverness. Recently there have been 2 GPs working in a surgery that usually has 5, with 10,000 patients on the books.
Many practices have already gone beyond breaking point. Across the Highlands, a number of practices have no GPs and are being run purely on locums alone. And I would say that most practices in Scotland are 1 or 2 GP resignations away from closure.
Medical professionals say the GP service is in crisis. A campaign's been launched demanding that government rebuild the system. They say 9 in 10 GPs think patients are not always safe at GP practices, and 7 out of 10 think this will get worse over time. A survey by the British Medical Association says 77% of GPs feel shortages put patient safety at risk. 86% of Scottish GPs have felt stress, anxiety or depression in the last year. And 65% of Scottish GPs don't think they have enough time with patients to allow for a proper diagnosis. The BMA recommends the safety limit for appointments is 25 patients a day. Scottish GPs see 28 on average. Patient groups say an overhaul is long overdue.
When the GP knew the patient, they were in a better position to treat them as a whole, which is what we really need. If they knew about your family background, perhaps various social events, they could weigh all that up in the diagnosis. Whereas now you just see a GP who's got your notes, what your last prescription was, and they're often in the dark as to what they're doing.
The Scottish Government says it's already delivered a record number of GPs working in Scotland, with more per head than any other country in the UK. It says it's committed to increasing the number of GPs in Scotland by 800 by 2027 and has recruited more than 2,400 healthcare professionals to support practices. Nicola McCally, STV News.